Good afternoon, ladies and gentlemen. If you're going to stay here, find your seats for me, please. Our next presenter is Reese Edwards. He is a healthcare industry consultant at SAS working on strategic initiatives and public policy issues with public and private sector customers. Reese is a strong advocate for the role of analytics in improving the healthcare system. Reese lives in Denver and has served on various trade and nonprofit boards. Without further ado, Reese Edwards.
All right, can you hear me okay? Perfect. Okay, one quick observation. It's Friday, not Sunday. This is not a church. Those aren't pews. I'm not a preacher. You're free to move up and get a little bit closer if you like. Okay.
Hallelujah.
I do not want to speak at you for 30 minutes, although if you force me to, I will. Do not hesitate to interrupt. Do not hesitate to ask me a question. I prefer this be an interactive conversation. A little bit about myself, more than what's in the bio. My name is Reese Edwards. I've spent the last 20 years in public policy and politics at one level or another. The last 10 years in healthcare. Prior to joining SAS, I was vice president with various different roles at United Health Group, involving state government affairs, implementation of the ACA, spent a couple of years in Brazil. And over that time, I got a big appreciation for what the power of analytics could do in healthcare. I got a big appreciation for exactly how complicated the American healthcare system is. Went to Brazil, did not come away satisfied that the Brazilian healthcare system was any better off than the American one, primarily because it mirrors the American one in many ways. Quick show of hands, not from anybody in the healthcare industry. Does anybody have any idea how much percentage, dollar terms, whatever, healthcare is to the American economy? Hazard a guess? 5%, 10%?
25.
Okay, 25, that's a good guess. 18% of GDP. No other country on earth comes anywhere close to spending the amount of money the United States healthcare system spends on providing coverage, access, and the delivery of care. The bulk of people are employer-sponsored health plans. That's where most of the money is spent, but the biggest individual spender on healthcare, one of the biggest drivers of change is the U.S. federal government, through either Medicaid, which they share with the states, or the Medicare program that they operate either themselves or through Medicare Advantage and supplemental plans operated by private insurers. The reason why I want to share this slide with you, particularly for the students, is this is a massive, massive industry in this country. Sometimes, and I know I'm in Wisconsin, I live in Denver, so I apologize if it's going to sound somewhat political, but sometimes we talk about the number of jobs in this sector or that sector, and it gets a lot of press. But the amount of people employed in healthcare vastly outnumbers a lot of industries that get more press. The U.S. Jobs Report was just released for the last quarter, or the last month, excuse me, this morning. 39,000 jobs were created in the U.S. over the last month. 40,000 of them were in education and healthcare, the vast majority of those being in healthcare, not the education part. So what I'm saying is, if you're looking for opportunities, there is going to be a tremendous amount of opportunity. It's also, and I want you to think about this, very, very complicated if you're on the consumer end of healthcare. Think about if you suffer from any of these diseases here, let alone 2 or 3, or you know somebody who does. If you've ever interacted with the healthcare system, you know it's extremely complicated, and the more problems you have, or the more issues that you have going on in your life, the more doctors you're going to see, the more specialists you're going to see, the more hospitals you're going to interact with, the more insurance forms you're going to see. All of those things generate massive amounts of complexity, they generate massive amounts of paperwork, and they generate massive amounts of data. Now, that's just if you're on the side of having something. There we go. All right, sorry about that. Seemingly something happened with my font. But think about the complexity of the system itself. You have the insurer side, the payer side, on this left-hand column here. In the middle, you have all the changes happening, episodes of care, value payment reform, bundled payments, industry consolidation, hospitals are buying doctors' practices, insurance companies are buying doctors' practices, ambulatory surgical centers, standalone ERs. I don't expect you to know what all of this means if you're not in this industry, but what I want you to take away is that I could have replaced this slide with a bowl of spaghetti and explained it just as well. It is massively, massively, massively complicated. Over here on the right-hand side is the delivery system. So these are your hospitals, your physicians' practices, everywhere we actually get care. Over here, people paying for care. They're constantly figuring out how to incentivize behaviors with how you interact in this system. People here in the middle, they're trying to disrupt both sides of this. And you as a consumer, or you as somebody who's a healthcare executive, have to figure out how to navigate all of this. Think about that. So, is it coherent and rational? Absolutely not. Does it drive people to madness? You are correct. It begins to look like something like this in your mind if you were going to position it, in your head. You're like, wow, it's chaotic, it's crazy. It's also throwing off massive amounts of data and creating massive amounts of opportunity. So, probably this comes as no surprise. We are in what they're calling the fourth industrial revolution. Analytics, AI, machine learning, natural language processing, all the things you're studying or all the things that you're seeing, feature function, whatever you want to call it, it's getting embedded in workflows. It's becoming more prevalent in the day-to-day operations of all sorts of industries, let alone healthcare. Healthcare, despite the fact that it's very advanced in many ways, is also kind of behind the curve. Fun fact, one of our largest customers, I work for SAS, from an industry standpoint, is the finance industry. And the finance industry has been very analytically advanced for a very long time because it involves so much money. Healthcare, because it's been fragmented, has invested in point solutions, has invested in a lot of individual analytic products, but it hasn't been necessarily end-to-end in the system. We're beginning to see how that's going to change. So for a new generation of analytic leaders, it's going to create those opportunities to solve these problems because that bowl of spaghetti needs to be straightened out. So, what are some of the big opportunities and what's driving these opportunities? As a political issue, healthcare is not going anywhere. It's going to be in the center of next year's elections, and then whoever wins that election and whoever controls the Congress will be controlling purse strings, plan design, and driving whatever the future of healthcare looks like. I got out of the political prediction business in 2016, so don't ask me what's going to happen. Value-based care, that is where we try to move away from the fee-for-service system that has so dominated the American healthcare system for the last 50, 60 years. It's the idea that we're going to pay for value and outcomes as opposed to actual services. So you just, the way it is in so many places, you string along a bunch of services, you bill for them, and you get paid for it, and who knows what the outcomes are. In trying to change those designs of how you pay and deliver for services is creating a massive amount of accountability, contract accountability, patient accountability, doctor accountability, behavior recognition, what's driving certain outcomes. It's not good enough to just prescribe something or do a procedure anymore. You have to begin to demonstrate what the end result's going to be. All of that involves analytics and data and massive amounts of data. Social determinants of health. Anybody heard of that term? Okay. Social determinants of health is the idea that what happens to a person's health, for those of you who don't know, is 80% outside of what happens in the doctor's office or the hospital's setting. It's what's going on in that person's life. You know, Greg had a great little slide right before me about, you know, your hands in the 212-degree, you know, boiling water, and then you have like your peer group, and then you have interventions. It's all about that at a community level. I'm currently working with a major payer provider in this country that has decided to make a significant $800 million plus investment in social determinants. It's trying to figure out what it can do analytically to find out what's going on in people's lives using data that's not just in a claim system, not just in an electronic records, electronic health record, but what's going on at the granular level, at the neighborhood, at the community, and even the family level, so that they can try to do interventions. Now, they're not naive. They know they're not social workers, and they know they're not going to cure poverty, and they're not going to cure behavioral challenges that people experience that affect their health. But they can influence it, or they can get an idea. And if they get an idea of what's happening in that person's life, they hope that they can be able to influence how they react when they are not in the doctor's office, or how maybe they can get their family involved. This is all very experimental stuff, and it's by no means figured out yet, which leads us to effective patient engagement strategies. We're trying to figure out what works. Is it the push notification? Is it the call? Is it making sure grandma has a ride to the doctor's office? Medicare Advantage, which is a privately run Medicare service for those 65 and over, is run by private health plans on behalf of the U.S. government. This year, just got more flexibility in what it could deliver from services. Traditionally, what counted as a service was pretty much all medical. Now they're allowing more flexibility for transportation, maybe to the doctor's office, maybe to the grocery store. Obviously, it's way too early to tell how these plan design changes will affect people's behavior and outcomes, but longitudinally over time, you're going to be able to get inferences and ideas about what's happening and what works. So then they would change the plan design to reflect what works best for the most amount of people. Does that make a lot of sense? But it's hard. We're going to have data scientists. We're going to have analytic leaders to help us figure that out. Businesses, governments that cannot do it all by themselves is required at this point. We're going to require massive amounts of information and massive amounts of collaboration. Industry consolidation, I referenced that a little bit earlier. While all these massive technological changes are happening, you have a lot of consolidation. United Health Group, my old employer, it's a $230+ billion company. Most people know that it's United Health Care, which is insurance, but it has a totally different arm called Optum that does pharmacy benefits delivery and management. It does revenue cycle management. It owns physician care practices. It owns minute clinics, the rapid clinics that you go to, if you cut yourself and you don't need to go to an ER. They own ambulatory surgical centers where you go in and have orthopedic, if you need a knee replaced, instead of going to a hospital and spending 2 nights, you might go there depending on your level of acuity, and then you go home the very next day. It's all about bundling together and experimenting to get the best cost and the best outcome at that cost. You heard some of the people previously today talk about how much money is involved in the system. I don't mean to sound crass any more than they didn't mean to sound crass, but money drives so much of this. And I don't want to take away anybody's idealism, but finding in a system where 18% of the U.S. economy is going to healthcare, and it is our next closest competitor is somewhere around 10 or 11% of GDP, we are not getting the results for the dollars we're spending, and it affects everybody's lives. So all of the players in this system are both trying to get as much money as they can and also trying to figure out how to deliver service in the best possible way. But they don't necessarily talk to each other. And because they don't talk to each other, that creates another opportunity. They're all racing to figure out how to put the best bundle of care together to meet people's needs. Last but very much not least, if you read the papers, you'll see that we are now in a drug price war. I actually wrote that bullet about 10 months ago for another presentation. I decided to keep it because it's only accelerated. Prior to joining SAS, I was in conversations with some PBMs, and they were pretty blatant with me that they were getting ready to go to war with pharma. Why? Because the cost of drugs has risen exponentially over the last decade. The drug companies, they have to meet their margin. Pharma has to meet, PBMs have to meet their margin. The PBMs are trying to move away from just drug negotiation prices to actually managing people's drug care. Once again, another analytic opportunity for those that are getting ready to come into this industry and for those already in it. So, analytic continuum, I don't think I'm necessarily showing anything you haven't seen before. The whole idea is we want to get up to here where we're sophisticated, we're not just doing dashboarding, we're actually predicting what's going to happen, we're getting inferences on what's going to happen in somebody's life, and then we're going to take a proactive approach to it. I would love to tell you that lots of healthcare organizations are up in this quadrant. My experience says is that we're more down here. A lot of people talk about, well, we're doing analytics in healthcare. That's true. However, is it analytics or is it trend reporting with nice visualization? Because what we're seeing a lot with the people that we work with is that when it comes down to it, they realize that they're down here. Some, not all, but some, and they know that they need to come up here. And this is a journey. They're not going to do this overnight, but that is the goal. And so the runway on this is multi-year. You're going to have to crawl before you walk, before you run. But once again, if I sound like a broken record, I apologize. That's where the opportunity lies. And you think about it, despite all the talk about the money and the value and trying to, whose pot it's going to go into, the fact of the matter is, if you can get up to here, and you can help a cancer patient get an insight that helps improve their care, or if you can help a diabetic manage their insulin better, or I'll use an example like from my own life. I have been dealing with the healthcare sector at a big high-level policy level. And then 3 years ago, my dad moved to Colorado, and I had to help start managing his care. And they learned after 7 surgeries that maybe they should send a nurse practitioner out of his house to do an evaluation. Well, that was great, and it's a great program. I'm certainly glad they did it. But that was after a year of surgeries. What if they're able to start saying, wait a minute, this guy's had 4 surgeries in 3 months? Maybe we need to send somebody out now rather than wait for these lagging claims indicators to say what's going to happen, that he's got a problem. Because what happens is he gets the service gets paid for, it all gets processed, but because the systems do not interact in real time, by the time the people that say, hey, we need to see what's going on in this person's life, they're having a lot of claims, looks like they're having a lot of issues, it can be months and months and months and months down the road. So if we can get up here to closer to real-time interaction, we can intervene in that person's life quicker, faster, better, and hopefully improve their outcomes. So an example of that, what I was just going through is, analytics playing a role in the journey. We have this idea that in a perfect world, we'll be able to profile what's going on in the patient's life. We'll give them a risk score, which is sort of just an insurance industry term that determines how high or low they are in importance in terms of where they are in their health care. It's definitely a way of sorting people out by their acuity, okay? We hopefully identify those care gaps so that we can plug and play where we need to, whether somebody might not be having something going on in their life, they need to have something going on. For a lot of older people, are they having social contact? Well, that doesn't necessarily come out in the data, but if the data shows that somebody might be suffering from the effects of social isolation, maybe then you can wrap around a social service to them to get to either to a community center or some sort of intervention where they're interacting with people so that they actually have more of a social life going on. We know social isolation leads to very negative consequences for people's mental and physical health over time. Personalized care plan, measure treatment outcomes, execute outreach campaigns. All of this has to work together, and I would argue none of it does on a system-wide level right now. All right, I'm going to actually blow through this one. You guys know what artificial intelligence is. This is the 30-second commercial. SAS has realized that all the problems that we're talking about, that I'm talking about, that the previous two speakers were talking about, exist throughout the healthcare system. So rather than just doing historically kind of feature function and natural language processing, artificial ML, all that's important. Lots of companies do that. We've decided that we need to concentrate more on healthcare itself as an industry. It's special enough, it has unique characteristics enough that we have decided to roll out our own sort of healthcare, we call it the health analytics framework. And the framework comes with, the $7 word is ontology, the $3 word is, it comes with stuff in it. That allows people to build cohorts, measure episodes of care, start looking at what's going on either the payer level or the provider level, and begin to take action and put models into the workflow, specifically in a healthcare situation. It's just too big of a market for us not to do that, and it's too specialized for us to just kind of do the generic analytics in a box type of situation that might exist in previous iterations of what we do.
Reese,
Yes?
does that previous slide, is all of that framework dependent on a SAS data warehouse itself?
Nope.
Or is it
No.
agnostic?
We have, yes, we have our products that it can be embedded in, from end to end, absolutely. Good question, Greg. It can live in an EDW, it can live in a cloud, it can live in Azure, it can live in AWS. It doesn't have to be proprietary to us. We've also, little SAS specific answer there. We realized that the world of open source has changed everything. So we're open source compatible, we're cloud compatible. Going from cloud compatible to cloud native is sort of the continuum there. Cloud compatible now, cloud native a couple years from now. Probably the best way to put that. So therefore, as we move forward with all of this healthcare initiatives, we believe that AI is going to be embedded all up and down the life cycle. For us, we call that deployment, data deployment discovery, or just data discovery deployment, excuse me. The whole idea being that this is just going to be seamless. The world of AI, I'm moving a little bit out of analytics and healthcare. I think this is more generic than it is healthcare specific. The entire world is going to be moving to AI native for large organizations and large enterprises, governments, business, you name it. And healthcare will become ubiquitous as well. We're seeing the beginnings of that. We believe the future of it will just be second nature. So, I think Tom mentioned this earlier. See, this is the problem when you're going nearly last. You have some repetitiveness here. Humans are not good at the pattern recognition in large data sets, as we all know, but they're good at the soft skills. And we want to take away all the stuff that interferes with a nurse or practitioner or an insurance company case manager diving into the paperwork 8 hours a day, or interfering with their time with the patient by tapping on a computer. One of the worst things I think I've read this year is that one of the fastest growing, from a percentage, it won't be a giant number, but as a percentage, one of the fastest growing fields in healthcare is healthcare scribe. And that is just someone that follows a doctor every single day, putting data into a computer while that doctor goes and does their rounds and does their patient visits. I think in 2019, the idea that we're bringing back a 20th and 19th century term shows that we have not figured out healthcare correctly in the United States. We need to make these things easy and seamless and deployed into the workflow in a way that makes sense, so that these people can concentrate on the most important part of their job, not filling out paperwork. So we want to take this, and we want to take this and all these forms. We want to automate as much of this as possible. We want to put pattern recognition as much of this as possible. You know, the workarounds in hospital systems to get around AI systems is very real. I've heard it myself. I've read the literature on it. It happens all the time. God knows you don't want to sit there figuring out insurance forms every day. You want to make sure that as much of this that can be automated into the workflow, whether you're a payer, or a provider, or even the consumer, is done. Okay? So that the people can then focus on what needs to be done. And that's focusing on delivering care and figuring out, you know, helping answer questions if you're calling in for a telemedicine visit or you're calling into a to a call center at an insurance company trying to figure out what your benefits problems are. Now, the investments in people and infrastructure, as I've alluded to, is going to be incredibly huge over the next 10 to 15 years. We're already seeing it. These are some examples of just what's happened this year. I do work with Common Spirit. We were in the middle of a project with them, and they stole somebody away from a giant consumer brand to come and be their chief digital officer. And someone asked me, said, well, Reese, why would somebody who has no healthcare experience come in and be the chief digital officer of one of the largest healthcare delivery programs in America? Are they making a big mistake? I said, no, they're not making a mistake. I said, this person has massive experience at the consumer level dealing with how people behave and interact with their product. Healthcare is notoriously bad at all of that. This is a savvy move. United Health Group, they announced last month that they're going to be embedding their analytics and all of the Optum delivery providers that are in their networks so that they can get better analytics there on the ground and try to bring more seamless real-time information between the healthcare payer and the healthcare provider. I pulled this one. I thought this was interesting. I did not realize this until I started doing the research for this presentation. In the first quarter of this year, of all the investments made in health, analytic investments were the #1 category of all venture capital invested in the United States. And then, of course, SAS earlier this year announced that we're putting $1 billion into AI over the next 3 years. The opportunity is real. And I keep talking about opportunity because I'm in a collegiate setting, and I've tried to tailor as much of what I'm going to say to you that are studying or thinking about studying analytics or you're thinking about getting healthcare. So this last one is for you, and this last message is for you. IT, analytics, early on in my experience, it was something that sat off to the side, and it was co-mingled, right? You know, is it IT or analytics? I'm calling somebody to get my computer, or I need a report, or whatever. Those days are gone. Sophisticated organizations are not treating information technology and analytics as a cost center. Sophisticated organizations are seeing it as a value center that's going to generate business opportunities. So for those of you who plan on going into analytics, I want to keep moving on, because I've only got 3 minutes, you're crucial to the success in the future. I don't want you to think that you'll be off doing something on the side and delivering it to some business leader. You're going to be the business leaders. You're going to be running the programs. The business leaders are getting less shy about coming to you and embedding you in their business operations. They understand that in order to extract value, they have to have people like you on the team. And so I would argue that, and I've seen this even in my own company, I would argue that if you become a data scientist or you become an analytics expert, and you go into healthcare, you try to get with a business leader that understands your value. You try to understand what their business problems are. Because a lot of times they sit there and they say, oh, we just need somebody to answer a question, and they don't even know what the necessary business case is. I think you should know what the business case is. I think you should know what you're trying to achieve and why it's important. So I would ask that you think of yourself not as somebody working on a project that's just going to sit over here. I want you to look at, you're going to be part of a team, you're going to be delivering value, you're going to be a leader, and what you say matters. And so you should walk out, if you remember absolutely nothing that I say today, that the absolute future of a successful organization will have analytics right there with the CIO, with the CEO, with the business manager, whoever's running the program. You have to be right there. Because I'm telling you, if you find a team and an organization that wants to do that, stick around, see what you're going to do. I think you're only limited by the creativity of yourselves and those that are around you. How much time do we have? Is that about it?
You got like 1 minute.
I have 1 minute. Any questions at 1 minute? Yes, sir.
For students who are looking to get like analytic jobs in the healthcare industry but don't really know much about healthcare, do you have any like recommendations on what they can do to be in that health, or is that a lot of job experience there?
So the question is, if I want to get into healthcare, but I'm not in healthcare, I'm an analyst. Okay. So, you know, the pat answer for me would be, there's going to be plenty of entry-level jobs, blah, 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 blah. I would argue that if you have a chance for an internship or something where you can get a mentor relationship going on, shadow an organization, I would look for those opportunities, particularly while you're in college and you potentially have time to do that. That will only increase your value in the marketplace.
All right.
Anyone else? Yes, sir.
And call me.
And call it, yeah, exactly. Yeah, I have my business cards too, exactly. Anybody else? Well, thank you very much for your time. Oh,
So, I was going to ask, in your experience in that roadmap, analytics roadmap,
yes, sir.
what percentage do you see of companies in that upper echelon healthcare? 10%? 15%?
I would argue, I'm not going to give you a percentage. It's a great question, and I put it up there, so it's fair game to ask me that. I will say this, I work with organizations that are vertically integrated, and they have large names that people in here might recognize. When you get under the covers, those vertically integrated organizations oftentimes have, say, an Epic EMR that doesn't talk to the claim system, that doesn't talk to the consumer management system. I guess I would say under 10% if I were going to guess, but they all know that they're on that journey. The good ones know they need to be on that journey. But it would surprise you how little integration and interoperability there is in this industry. Yes, sir.
I think, based on what you said, it's funny that a lot of investments going into AI, because it seems like automation is the first step, or integration, right?
Sure.
You can't really take a step to AI if you can't even look at all the data, right?
Right.
They're all separate, disparate systems.
Yes, and you know, one of the things that we tell people is you need to be able to extract and meld all that data together as part of your strategic plan. I mean, it is not, I think sometimes people think, oh, you just do your magic and then here's a report. Well, that's a report. It's not embedded in the workflow. It's not a process change. It requires rethinking. It's every bit as sophisticated in today's world to get that right as it was to get the assembly line right when they first started manufacturing automobiles, right? I mean, you needed to be end to end. You're absolutely right.
All right, we are unfortunately out of time. Thank you, Reese.
Thank you, everybody.